Thank you. Thank you very much, Jane and Jeremy, for inviting me. I wish I could be with you. So here is my talk. It's about low-dose ionizing radiation and medical therapies. And this is the contents of my presentation. And we'll move to the first item, COVID-19, a very topical topic. So the big problem with this disease is it kills people. High mortality, especially with older people, as they get acute respiratory distress syndrome. And it turns out from past experience, treatments of pneumonia in the 1920s to 1940s, that one X-ray, 0.5 gray treatment to the lungs stops this pneumonia, which is induced by the immune system overreaction. So you have this inflammation. Now there's 15 clinical trials underway now to demonstrate and get approval for this treatment as an accepted medical treatment. There's a lot of political resistance to this idea of using radiation to stimulate or to modify rather than to kill cells. So you can see a picture of lungs, a healthy one, a normal one, and a pneumonia. You see that due to the overreaction of the immune system, the lungs fill up with fluids and debris, and it blocks the passage of oxygen from the air to the bloodstream, and that causes suffocation and death. So I realized this way back in March when I started to understand what was happening. And I wrote a letter to the FDA, Stephen Hahn, who's a radiation oncologist, interestingly, and I urged him to start a clinical trial on half-gray chest X-ray as a potential remedy for this inflammation. And he never got a reply from him, but my letter went viral. And a lot of radiation oncologists, these are the people that really understand the effects of radiation. They raised proposals. And so clinical trials started, had to go through the institutional review boards. This is the first one that got started at Emory University in Atlanta. Colleagues Mohammed Khan and Clayton Hess started a trial in April. They took patients who were very severely affected, old ones with complications. And the first 10 that they treated, and then you can see the much quicker recovery from the pneumonia. One patient died because these were very advanced cases, but 9 of them recovered, left the hospital within days. And you can see the controls, the ones that got normal treatments, took weeks. So we have some evidence. It's not good statistics, but we knew this would work because it was used commonly in the 1940s. So this is my introduction. I've been many times at your conferences. I finished engineering physics in 1964 and got my master's and doctorate in Israel at the 1968-71. Worked 25 years with Atomic Energy of Canada, working on design, construction, and operation of 25 reactors. I retired in 2000 and been consulting and involved with many organizations. In 1995, the Centennial began to work with medical scientists and radiobiologists to understand the health effects of ionizing radiation, written many papers and journals. And recently, I've been treating Alzheimer's disease in very advanced cases, severe. And I've also worked with a colleague of mine in Japan on the treatment with radon gas. We published several papers on that. And as I mentioned, I've been working on COVID-19 with collaborating with radiation oncologists around the world. So This is a paper that was published in Los Alamos newsletter at the Centennial 1995, and it reviews radiation and risk and hard look at the data. And this article points out that the effects of radiation are much different than what the radiation protection people are telling us. This is a book I got actually from Ted Rockwell. Marshall Brucer wrote a chronology from the beginning, 1890s to 100 years. 1990 was published. And on the right is another book by a colleague, Chuck Saunders, published a few years ago. This talks about a lot of the evidence on radiation effects, beneficial effects, hormesis. As you know, Maria Curie discovered radium in 1898. And this is a report, a book by Argonne National Labs by Robert Rowland. He did a review of radiation in humans. I studied the radium dial painters mainly, but he points out at the beginning that there was a company in the US, radium chemical company, was supplying radium and people, it was accepted medical therapy to use radium externally in pads and also internally. They were drinking these 2-ounce bottles with 2 micrograms of radium, and 400,000 bottles were sold over the counter. This stopped after a celebrity overdosed and got jaw necrosis and died. They've identified 4,000 plus radium dial painters in the US, and these painters were pointing the brush they were using on the to paint the instrument dials with radium phosphor, and they ingested radium. And so the question came up, how much radium is harmful, because some of these began to get malignancies. So this is a study on 1,468 dial painters, and the 56 of them had malignancies, and all of them were above a threshold of 100 micrograms of radium ingested. So we have evidence here of a threshold. And in 1925, the dial painters were instructed not to point the brush in the lips. And after that, there were no more high cases of radium ingestion. They were all below this threshold. And so there were, in this group, there were only 56 malignancies, but the news media makes it up as if much higher percentage of them died. They did follow up on these patients. They got bone samples, and they did a lot of studies on them. And there's a repository in Richland, Washington with biological samples. So this is another study by Rob Lee Evans from MIT. He was looking at bone cancer, and he found that there was a threshold for a cumulative dose of 1,000 rad centigrade, 10 gray. And you see there were no bone cancers until that level was exceeded. And even then, no more than 30% or so had bone cancer. So humans can tolerate quite a lot of radium. Let's talk about the low-dose radiation treatments. They've been done for more than 120 years. So they were using X-rays and radium to treat cancer, slow its progression, eliminate metastases, heal wounds faster, stop infections, gas gangrene, carbuncles, boils, sinus, inner ear, whooping cough, and there's pneumonia, COVID-19 type, viral. They relieved arthritis, inflammatory conditions, lymph glands, adenoids inflamed, treated asthma, autoimmune diseases, type 1 diabetes. In these studies, you don't read any reports of any increased cancer in the patients. The radiologists had problems. They were overdosed in many cases, but Some patients were also, I guess, received overdoses. They had burns, but there was no reports of cancer. So what's the mechanism for the beneficial effects? Well, organisms require redox cell signaling agents. Superoxide and hydrogen peroxide, these are produced internally by the mitochondria and various enzymes and other sources and processes. So these are essential agents. However, the superoxides and reactive oxygen species cause oxidative damage to all molecules, and including the DNA. And organisms have powerful innate adaptive protection systems that prevent, repair, and remove DNA damage from all sources, and they restore good health. This is what keeps us alive. It's essential for survival, but our protection systems get weaker as we get older. This is a model by Polyakov and Feinendagen. It shows, it's a picture that shows the natural defenses. You can see on the vertical axis, there's a lot of cells in our bodies, and each one of them, if we didn't have prevention, potentially we would have damage, 10 to the 9th events per cell per day. But because of the antioxidant production in our prevention systems, we have a reduction of 3 orders of magnitude, and the actual alterations that occur is 1 million events per cell per day. We have remarkable repair systems working, and they bring the damage down by 4 orders of magnitude to 100 events per cell per day. And then we have remarkable removal, brings it down by a factor of 100. Cells commit suicide is P53 enzyme and necrosis. And of course, the immune system destroys cells that are not normal. So what typically happens is every cell gets a mutation a day. Organisms, well, they need oxygen for energy, but and they produce these agents, cell redox agents, but cause widespread damage and stress, as I've mentioned. So this is what the effect of ionizing radiation is. You have direct hits on DNA, and also you get radiolysis, which produces ROS, reactive oxygen species. And I'm getting pop-ups here. And so what does a burst of radiation do? Well, it triggers your protection systems. These hits, a high dose above the threshold for harm inhibits or damages the protection systems. But a low dose, which below the threshold for harm, stimulates our protection systems to over-respond. And they remediate damage not only from the radiation, but all internal causes, such as the oxidative aging I mentioned, immune disorders, and external things like infections, toxins, injuries. So you can get improved protection as a result of a burst of radiation from a low dose. So this is a dose response model, the hormetic one. You see health effects going up vertically, and along the bottom is the radiation dose or the dose rate. And you can see that below the threshold for harm, you get induced beneficial effects. And there's an optimum dose or dose rate. And then above the threshold, you see harmful effects, death, burns. So this is an interesting picture concept that shows the effect of a single dose of radiation treatment. You can see there's some damage produced, and then there's protection system responds, removes the damage, you get recovery, and it overshoots. And if you produce a sequence of these treatments at the right timing, you can actually increase the recovery, not only from where it was, but net benefit. It's longer lasting. So how does radiation affect cancer? Well, the first thing is that high dose inhibits the cancer-fighting immune system, as we point out. If you don't have an effective immune system, your natural occurrence of cancer would go up. But there's also the effect of mutations. So the blood-forming cells in bone marrow are very sensitive to radiation. So we could expect radiation-induced mutations in bone marrow cells. And in fact, there is radiation-induced leukemia, which is observed in Hiroshima and Nagasaki. And this has a latency of about 5 years before it appears. So studying the Hiroshima survivors, we saw there's a threshold of radiation-induced leukemia at 1.1 gray. And this threshold is quite high. It's above the treatments that we give for low-dose treatments. So these treatments are safe. There's also evidence of a dose rate threshold at 600 milligray per year. So this is a high radiation level from contamination or background or high background areas. And you can see there's a threshold there before there's lifespan shortening. So this is evidence that I put together from Hiroshima leukemia cases. These are the survivors. This is 96,000 atomic bomb survivors. And if you look at the data from January 1950, that's 5 years after, to December 57, 8 years, there's a slight increase in the incidence of leukemia, and then it peters out and dies away after these 8 years. And the cases were observed in zones A and B. There were 48 extra excess cases and 10,000 people who survived in those zones. So that's only 0.5% of those people that actually got leukemia. So with all the hype about radiation-induced cancer, you'd expect there would be much more, especially for these high exposures. And it's not really there. So there's the threshold that this is the data from the different zones. I've got a table there of the zones, how far they are from ground zero. And these people survived heat and blast and the radiation, and still there wasn't that much increase in leukemia. So this hype about radiation causing cancer is really overblown. This is a study, you can't do this on humans. This is beagle dogs exposed lifelong to cobalt-60 radiation. And you can see they're fairly high dose rates. And then there's the controls, dogs, the average life of 4,500 days, 4,500 days. And you can see there's a threshold at 600 milligray per year when you project the data from the very high background levels. So exposures below that threshold are not harmful, probably beneficial. So there's no big need to evacuate places like Fukushima and even Chernobyl, because they never got to these high thresholds long term. Let's look at the Chernobyl firefighters. They survived quite high doses. This is a table from the OECD report by the Nuclear Energy Agency. This is 10 years after the accident. See, there were 28 deaths from these firefighters, the liquidators, those that got high doses, and they followed these up. So if you look at 134 persons who were heavily irradiated and treated, 28 died. They got doses above 5 gray. And then there was 106 that remained alive after a year. And they followed them up for 19 years, and they found that of the 106 that survived, 22 died. It's a death rate of about 1% per year. And if you follow up for 30 years to 2016, 26, 4 more died. And that's a death rate of 0.8% per year. And if you look at the unexposed workers, their mortality at 2000 was 1.4%. So there's certainly no evidence from, it's not the highest statistics, but there's certainly no evidence in these survived workers showing a higher death rate. And if you look at the cancer mortality of the 26 who died, it was only 27%, about the same as cancer mortality of all deaths in Central Europe, of normal people. So the cancer rate was, so this panic about delayed effects, well, it doesn't appear in these people who received high exposures. Going on to another topic, Ed Calabrese and his colleagues have been publishing papers on the history of treatments many years ago, and this is for whooping cough, sinus, pneumonia, ear infections. And there's more papers on gas gangrene, low doses treatments for wound healing, boils and carbuncles and bronchial asthma. And this is a book by Kelly and Dowell, published in 1942, where they treat 384 patients with, these people had infections. They used the low doses of x-rays. And at the right, you can see there's a paper by them, published in 1941, of a case of gas gangrene infection from an agricultural industry. The hand was broken, damaged. Normal treatment for a gas gangrene infection like that would be amputation. But giving 3 treatments of 50 rad, 0.5 gray, half a day apart, produced, well, it cured the infection and the bones were reconnected and the hand was saved. So if you look at the treatments that were done way back using x-rays to treat gas gangrene, they reduced the mortality rate of these patients from 50% down to 5% just by using low dose radiation treatments on the wounded area, on the infected areas. That's strong medicine. Following that, there's a recent paper, actually last year, by Calabrese's people, colleagues, and they're postulating that low-dose radiation could be used to treat flesh-eating disease instead of amputation, cure the infections. This needs to be tried, but it's not accepted by normal medicine, medical community. This is a treatment, very remarkable, was used on hundreds of thousands of children, US and Canada and Europe. They injected, or they positioned radium probes in their nasopharynx. And this was used to treat inflammations, inflamed adenoids. And for Navy pilots, they had problems with eustachian tubes, some of them, because they were flying planes that were not pressurized. And well, they found that they got beneficial effects for the adenoids, and they treated the Navy pilots, and they were able to, they removed tissue from the eustachian tubes that was blocking their equalization of pressure in the inner ear. So they followed up, and this is the doses that were given to nearby organs. The pituitary gland, the salivary gland, the brain, thyroid, fairly high doses, and yet there's no evidence of any link to any disease from all these treatments. So you can see the circled areas there. This is National Cancer Institute, came out in 2003, and it's still on the website. And so there you are, 500,000 to 2.5 million children in the US and 8,000 pilots treated. And at this time, worldwide studies have not confirmed a link between NRI exposure and any disease. So this panic, radiation phobia, is unfounded. We have evidence that shows that these high exposures did not cause long-lived diseases, latent diseases. And Ed Calabrese and his colleagues did a review of many studies were carried out in the early 1900s, hundreds of clinical studies, 37,000 patients, and they found that they were beneficial. There were no adverse effects. Not everyone was cured, but they found an optimum dose for treatment of between 30 Roentgen and 100 Roentgen. So this is a table in that paper, and it shows the different conditions: arthritis, bronchial asthma, carbuncles, deafness, furuncles, gas gangrene. You see pneumonia there. There's 863 cases. 771 got better. Very high treatment, successful treatments. 60 to 90+%. That's 37,500 patients. Now, this is the publication of the U.S. National Academy of Sciences in 1956 in Science. They took the evidence of Muller, and they had a genetics committee, and they put out a radiation scare recommending using a linear model to predict incidence of mutations and cancers. And so this radiation scare, the motive behind it, one of them was to stop atomic bomb testing because it created a scare from the fallout from these bomb tests. So Calabrese spent years, 10 years at least, reviewing what went on, and he studied the history of this recommendation, calls it LNT Gate, so similar to Watergate. Some people may remember back then. So he says his review identified ideological motivated decision based on deliberate falsification and fabrication of research record. The genetics panel had recommendation had far-reaching influence, cancer risk assessment. Everyone in the world was misled. And this caused a lot of problems. So the cancer scare, this is interesting. This is from that Los Alamos paper I showed you the cover earlier. This shows that in 1924, the scientists determined a tolerance dose, annual dose limit for a radiologist, 70 rem per year. And then you see how it drops when Muller discovers X-rays cause fruit fly mutations, and a few years later, 1934, it dropped to 30 rem. And then Hiroshima, Nagasaki bombing, concern about leukemia, so bone marrow dose, it drops again. And then the National Academy Sciences issues their recommendation, and it drops again. So from 1924 to 1993, it goes down by a factor of 70. This is all due to changing perception of radiation risk. And you can see for the public, it's much, much lower. So this is what's driving the fear, the shutdown of Indian Point reactor in New York State, and well, the stopping of the nuclear energy industry in the Western world, this cancer scare. So after 1956, that recommendation from National Academy of Sciences, radiation treatments to stimulate became very controversial, and concerns are always raised about mutations in cancer. Incidentally, there's a new paper from Calabrese shows that there is evidence The survivors of Hiroshima and Nagasaki, their children, no evidence of mutations in the babies, were born years after these exposures. And that evidence was presented to the National Academy of Science, the genetics panel, and they rejected it, ignored it. So physicians have replaced the low-dose radiation treatments with antibiotics and pharmaceuticals. Physicians are carefully taught that any radiation risks cancer, got away a potential benefit of a diagnostic scan against the risk of cancer, calculated by the linear model. There's no funding to perform clinical studies on low-dose ionizing radiation therapy, and we have case reports when low-dose benefits were observed in specific cases. So this is a book that radiologists learn from, and physicians are taught that. And the book doesn't mention that organisms produce redox cell signaling agents, the ROS, that cause oxidative damage. They don't mention that organisms have powerful protection systems that remediate this internal cause and external causes of damage. They don't talk about the low dose of radiation that stimulates these protection systems, stimulates immunity. You get beneficial effects. It's not mentioned. They don't mention the thresholds for onset of harm, cancer, and even the dose rate threshold for low-level background as a threshold before you get any adverse effects. So let's go on to Dr. Sakamoto, who did clinical studies on patients with low-dose radiation. This is a paper he produced with his team many years ago, 1997. He did fundamental studies on mice and then clinical studies. So this study was done in the late 1970s, where he injected lung colonies of, lung metastases, lung cancer, and transplanted into the groin. And you can see these mice, different groups were given different radiation exposures. Those that received high exposures, their immune system was compromised and they had higher incidence of colonies in the lungs. And then those that received low doses actually had significantly lower colonies of these metastases. And you can see the controls at 0 dose. And he sees an optimum there of 0.15 gray. Single dose produces the best stimulation of immunity. So he developed the treatment at that optimum based on the mice for use on humans, 15 centigray, 0.15 gray, twice a week for 5 weeks, 150 centigray total. This is half body, or it's also can be done whole body. And he sees total removal of tumors. For example, one of the patients, the first ones he treated, had ovarian cancer, and this treatment removed all the metastases. He did studies on 200 patients approximately. This is studies on non-Hodgkin's lymphoma, normal therapy for treatment for that disease. You get a long-term cure of 50% of the patients, and using half body or whole body total body low-dose radiation, you improve the cure rate to 84%. My colleague James Welsh treated a patient. He's someone in captain in Rickover's Navy, Ed Bowser. Treated him in 1999. They published this finally in 2004. He had Waldenstrom's macroglobulinemia. Your bone marrow overproduces IgM antibody and plugs up your blood system and eventually produces death, anemia. Blood flow doesn't work well because of high viscosity. And he produced repeated treatments, repeated improvements. Fellow was building homes and habitat after treatment. And finally died years later age 85. This is a colleague of mine who had hurdle cell cancer. It's a cancer of the thyroid gland. He was treated, the thyroid removed, and 10 years later he developed metastases in his lungs. And he asked for Dr. Sakamoto's treatment. This happened in Mississauga in Canada. He received treatment and the tumor shrunk. The thyroglobulin in his blood system went down by order of magnitude, and the problem became, he wasn't worried about it anymore. He died from heart failure, but he was the first person in Canada treated. Second person was my wife. She had ovarian cancer, a 1-inch tumor, grade 3, stage 1. After the surgery, I was concerned because it was bleeding, this tumor, so I asked for prophylactic treatment. Dr. Sakamoto, sitting there with my wife, recommended, produced a request referral, and she was treated in Mississauga in 2011 with 150 milligray twice a week, same Sakamoto treatment, and well, she's 9 years later, she's in very good shape. It's a paper by Myron Polikov on the radiobiological basis for low-dose irradiation and prevention and therapy of cancer. Very good paper, 2007. It's worth reading. Has all this evidence. And this is a colleague of mine in Japan, Kojima, and his team. They did Sakamoto's treatment. There are 2 cases of prostate cancer and 1 of colitis, ulcerative colitis. So these 2 patients, they had, this is metastasized prostate cancer. They received normal treatments. They were able to bring down the PSA biomarker to 5. And then they gave them Sakamoto's treatment, total body radiation, and they brought it into remission. And sat with 2 patients. This is a picture of metastases and front and back before treatment and after treatment. They were all gone. So successful treatment. And the patient with the colitis received radon treatment, and that went into remission. And this is a paper that I helped him write on using alpha-emitting nucleides. There's targeted and non-targeted. Non-targeted is radon therapy, and this is radon. You see it produced by radium. Radium has a long half-life, 1,600 years. Radon's only 4 days, and it gives off 4 alpha particles before it ends up as lead 209, 208. Anyhow, most of this gas is exhaled when you inhale it, but some of it does remain, and it stays in the blood, it dissolves, and so we get strong medicine from this. So you can produce this in a radon room by lining the walls of the room with uranium ore, or you can make a radon generator. This is where you put uranium ore in a tank of water. You bring out tubes, and the radon gas that comes out is brought to the patient, get to inhale. This is a patient, there are 2 of them, with breast cancer metastasized. See, there was a tumor in her brain, was moving her eye aside. And after the treatment, you can see the markers went down dramatically. She went into remission, and her eye came back to normal. Tumor in the brain disappeared. Second patient also got significant improvement. The markers went into remission. The first one had radon generator treatment. The second one was in a hormesis room. And this 4 cases of cancer treated with radon, 2 of them in the radon room and 2 of them with the radon generator. Treated colon cancer, uterine cancer, lung cancer, and liver cell cancer. I helped them write the paper. There's problems in English and composition that I was very useful in helping them. It helps when you understand this. So this is an image of a person with lung cancer, metastases in the brain, and after the treatment, metastases were gone. Patient went into remission. This is a patient with severe liver cell cancer. And using normal treatments, they brought it down to these markers. But 1 megabecquerel treatment concentration was not good enough to bring it into remission. But when he upped the concentration in the radon generator to 6 megabecquerels, a 40-minute exposure every day, brought it into remission. This is serious, strong medicine. And then there's rheumatoid arthritis, treated 15 months of therapy. This was in a radon room and also a nebulator inhaled from. This is the patient. She's smiling now, but she was in severe pain, couldn't lift her arms, couldn't move much. 10 years suffering with rheumatoid arthritis, taking conventional treatments. And treatment brought it down. You can see the markers. And she still gets, I think, 2 treatments a month. She comes in to the clinic and she maintains, well, she's in good health. This is radon therapy for autoimmune diseases. This is skin autoimmune disease, pemphigus, and case of diabetes type 1. And this is the autoimmune disease, what it produces on the surface. The immune system attacks the cells underneath the skin, produces the sores, they're bleeding, it's painful, have to wear bandages. So after the radon therapy, it's very remediated. The lady was able to go back to work, and I think she still gets occasional treatments. Use the radon generator. Here I was treating Alzheimer's disease. This is 2015. A colleague in Michigan phoned me, Eugene Moore, he's the Parkinson patient. That's me on the left. And that's his wife. She was severe, she was in hospice. So the way it happened was he called me in April. He put his wife in hospice. Can we do anything? I said, well, I've read a paper by a colleague suggesting that low doses of radiation would help to control neurodegenerative diseases. That's the paper published in 2014. So the patient was completely non-responsive, age 81, diagnosed 10 years ago with Alzheimer's. Progressed to final stage. She refused medication, non-communicative, stayed in her wheelchair, no attempt to move out of it. I suggested whole body X-ray radiation, but we couldn't get that approved by anybody. So her MD internist prescribed the CT scans of her brain. The husband was quoted 4,000 included image analysis of a CT scan. He said he just wanted the radiation, so he paid $75 self-paid, no insurance, no analysis. And she moved during the first treatment in July 23rd, so they gave her a second treatment. The operator thought they were interested in the image, so he just repeated it when the patient moves. So the first treatment was a double dose of 80 milligray. Next morning, the caregiver observed big improvements, cognition, memory, speech, movement, appetite, observed by husbands and also visiting friends. She didn't recognize her son. So here she is with better appetite. She's eating by herself. And when I asked her to look at the camera, she picked her head up and looked at my cell phone that the caregiver was holding. And so we have another picture of her responsive to my request. So I was aware that this treatment would likely fade, so I suggested repeating treatments, 2 scans a week. Physician approved 1 scan every 2 weeks. So we saw further improvements. And November the 20th, she was transferred from hospice to a home for seniors with stimulating daycare program. She was so much better. And she got ongoing treatments during 2016, the following year. So she had improved quality of life for at least a year. And these are the treatments that we gave her. We varied the time to see whether there was an optimum. And this is a report from a neuropsychologist discussing her improvements. And eventually she deteriorated in 2017. She died in 2018. Lost the ability to swallow food, weight declined. She died on May the 18th, 2018. Her husband had Parkinson, as I mentioned, so he asked for the same treatment. He saw immediate improvement. The next night he went to sleep after the treatment, and the tremors stopped. He lowered his dose from 6 pills a day to 2 to 3. And then he got himself tested and started getting additional treatments. And this is the effect of the treatments on the Parkinson disease. The medication, he stopped eventually taking pills. Tremors decreased after each CT scan. He found that 4 to 6 weeks was optimal. His vision improved, his hearing improved, and he had neuropsychological evaluation, some notable improvements, and some mild declines. So these are the papers that I wrote as a result of this case 2016, and I did updates in 2017 and 2018. I was trying to get other places to repeat this treatment to show that it was replicable. Finally, I succeeded in urging Baycrest and Sunnybrook Hospital in my city in Toronto, Canada, to do clinical trial on severe Alzheimer's patients. Just to repeat, I got it approved by 2 research ethics boards. There was no funding provided. I got the trial registered, and we treated 5 patients in 2019. One was a very severe case, showed no improvement. The other 4 did improve. We used objective evaluation measures, which didn't show much, but when you looked at subjective evidence, the 4 patients recognized and spoke with relatives and others. Big improvements. So I've written the paper, submitted to a medical journal. We got peer review. I've responded to the comments, and I've revised the paper, and we're ready to resubmit it. So we have a pilot study was completed in Toronto. I'd like to do a larger clinical study on Alzheimer's. I use a low-cost device, ortho voltage X-ray device instead of an expensive CT scanner, and determine the optimum dose, optimum time between treatments. We should use a biological marker and develop a protocol for patients at different stages of AD to delay, stop, or reverse neurodegeneration. Now here's another opportunity. I have glaucoma in my left eye, and it's not getting any better. They're controlling it with laser treatments to intraocular pressure to keep it normal, but there's degradation in the ganglion cells, and I've seen papers defining it as a neurodegenerative disease. I would like to get scans for myself, CT scans, to try and reverse the glaucoma, and won't be able to do that until we publish the paper and I make a strong case for a case study. So that's the end of my presentation. These are the conclusions. You can read them yourself, but the organisms, they produce reactive oxygen species, causes a high rate of damage. We have protection systems, against this damage and also against all internal and external causes of damage. A low dose stimulates your protection, including the immune system. And it's been used for 120 years to treat infections, cancer, inflammations, and autoimmune diseases. The National Academy of Sciences misled the world in '56, recommending this LNT model to assess risk of mutation and cancers from radiation. Physicians stopped using this therapy, disregarded all information about remarkable efficacy. Medical textbooks follow LNT. They omit information on radiation stimulation. There's follow-up studies on many thousands, including children. Nasal radium irradiation, no definitive link to any disease. Radium intake, we have a threshold for that, and a cumulative dose for bone cancer. We have evidence of a threshold for high dose for causing harm, and a low dose and a dose rate threshold also for continuous level of radiation in the environment. So we know what areas are harmful. Radon therapy is very important for treating different cancers and autoimmune diseases. And we can't start clinical trials because can't get medical endorsement or external funding. So that's my presentation, and I left some time for questions if any have. Thank you.
Thank you, Dr. Cuttler. So we're going to have some discussion and Q&A now. I'm going to ask the people who asked the question or have a comment to come here, because then Dr. Cuttler can hear you as well, okay? And so can everybody else.
Okay, can you hear me all right?
Yes, I hear you well.
I have two comments. This presentation, of course, is fabulous. The center, you mentioned the fight in the 1950s over atomic testing. The centerpiece of that fight was a debate between Edward...
Sorry, I don't hear well.
Can you hear me?
Talk slower. And
the centerpiece of that fight was a debate between Edward Teller and Linus Pauling. Linus,
yes.
With no data at low levels, simply extrapolated to zero linearly with the linear hypothesis. Read off, and Teller had increased the amount of carbon-14 in the atmosphere due to atomic testing. So Linus read off to a very low level from the linear plot, multiplied by the population of the world, accused Teller of killing thousands of people with C14, and one.
I remember it. He wrote a letter, a telegram to President Kennedy.
And because of that win, Pauling got the Nobel Prize for Peace. But the reason I'm commenting is because of something else. I worked with Linus for 15 years, and in the early 70s, we had two laboratories, one at Stanford and one at UC San Diego, and I was directing both. And the one in San Diego, my graduate students and I got interested in vitamin C, because Linus was interested. And we learned, I won't go through the whole sequence of experiments, but I'll describe the phenomenon. If you take the vitamin C at physiological levels, and you dissolve that in a buffer, that's a pH-controlled solution, and you put a protein, any protein molecule, you know, these are complex molecules, polyamino acids, which do everything in your bodies. Anyway, you put a protein molecule, vitamin C, and buffer it at pH and put it in a beaker, in a flask, and deoxygenate the flask, so there's no oxygen present. In the morning, when you come back, if you look at it, all the protein is still protein. But if you allow oxygen in the flask, when you come back the next day, there'll be no protein, just fragments. And it totally wipes out the protein. Sort of like gamma rays, you know, there's no chemistry that takes place. The gamma ray is too powerful. It just causes a lot of damage, and that stimulates the immune system. And that's what he's talking about. Vitamin C does the same thing. And we studied this, and my students and I discovered that vitamin C in the presence of oxygen in physiological solutions reacts with oxygen to make free radicals and peroxides, which do exactly the same thing as the gamma rays, tear up protein molecules, produce fragments in the solution, and these stimulate the immune system. Linus was always looking for some way to explain why the immune system is stimulated by vitamin C. And the irony is it's stimulated by vitamin C tearing up the macromolecules, producing fragments, and the immune system responds just as it does in the thing he's talking about. So if you take a little vitamin C, it does that. It stimulates your immune system. I think taking 50 grams a day, as some people recommend, should only be done when you're sick, because you also cause a danger that you will go over this threshold, the threshold that you see with the radiation. No one knows where that threshold is, but it's not a good idea to play games with it. So vitamin C works by the same mechanism, and it's called an antioxidant, which is odd because it is a source of free radicals and peroxides, and its effect on the immune system is exactly the same as the one that he's telling you about for radiation. Thank you.
Thank you. Yes, I understand that.
We have a lot of comments and questions, so please do your best to keep it brief so everybody can answer.
Jerry, this is Jay Lair. I want to make two comments. One, the beginning of the recognizing radon as a positive was actually done by Bernie Cohen, who was a regular at the DDP meetings, probably even before you became a regular. And in conversations with Bernie, he found, of course, that excess quantities of natural radon reduced lung cancer in, well, they tested counties over 90% of the population of the United States. But my more important comment is that, as you know, Ed Calabrese has a extensive paper awaiting publication in environmental research. He was able to gather together all of the correspondence going back to 1922 of Professor Mueller, who ultimately got the Nobel Prize for his fraudulent work leading to the linear non-threshold. And Ed, in his about a 20-page paper, details all the correspondence, proves beyond a shadow of a doubt the criminal fraud in leading to EPA maintaining a low-dose, linear no-dose rule. Ed gave me permission to write two papers from his yet-to-be-published paper summarizing all the data that he has discovered and then analyzed. The first paper was published at American Out Loud about a week ago, and the second paper will be published at this coming week, Monday or Tuesday, at cfact.org, totally exposing and summarizing the brilliant work that Ed Calabrese has done now for 40 years, all of which you are well aware of. But your paper was absolutely fabulous. Thank you.
Thank you, and I look forward to reading yours article.
Thanks. Excellent paper.
Here, can you take your mask off? Shield off.
Thanks. Excellent paper. My
Thank you.
PhD is in radiation biology and biophysics. Everything you said is correct, except I think there was one thing that I didn't hear. For 0.5 gray, you said safe. I wouldn't recommend it for pregnant women.
Well, we do have data from Hiroshima and Nagasaki on the effects of radiation on pregnant women. There's a study done by Neil and his colleague, Schul. And you have to look at that evidence. There are many thousands of patients who were pregnant who recovered.
So this is Stephen Johnston. Jerry, that's very interesting, all these anecdotal and low number experiments, but I don't think they're going to convince anybody to really.
I know that. They call it anecdotes, I call them facts. What can you do?
But it's not going to convince a negative community.
Even if you show them the evidence, they still won't be convinced.
So what's the prospects of doing the perfect experiment of getting a large cave with low dose or little radiation, with a lot of mice in there, and give them controlled doses from 0 up, and look at aging and cancer and other things, and do a definitive experiment on this.
Well, a lot of studies have been done on mice. People will argue that studies on mice do not determine what's going to happen with humans. So what's going to convince them is humans. And now we have treatments that are coming now on COVID-19. There's 15 clinical trials, and hopefully that will produce evidence that low doses do modify the inflammation, are helpful for that treatment. Regarding Alzheimer's disease, that's going to be a big cost item after we recover from COVID. And you look at the population that's going to be getting Alzheimer's disease. The stories I hear from the doctors I work with, they say that once you get over 80, half of the people are going to have dementia, Alzheimer's, and the other half of the population are going to be looking after them. So we have a great future.
Hello, my name is James Enstrom. I've had a long career as an epidemiologist at UCLA, and I've watched the misuse of epidemiology in many areas. And this is, what you were discussing is a perfect example, and I commend you on such a good talk. In this era of social and civil disruption, have you and Ed and some of the others considered just directly confronting the staff members at EPA and the National Academy of Sciences about the misuse of the actual evidence? I think it takes direct confrontation in this day, or we're just going to continue with these misleading limits, and all of your work is just going to be minimized. So what do you think of that approach?
It's difficult. The only one who seems to have influence is the president. Nobody else listens to what I or anyone else has to say. I submitted an article on the request of the American Nuclear Society to be published in Nuclear News, and it was rejected. The people in the ANS directors read the article, and they said, no, this is dynamite. We can't publish this. So I'm publishing it in a scientific journal. But there's a lot of opposition. People are earning good careers protecting people, and that's not going to change. Thank you.
Dr. Cuttler, I found your presentation fascinating. I come from a family of afflicted by cancer. I myself had radiation treatment for cancer, and I have recently become made aware of an exciting new technology called, it's actually an Israeli company, a new company called Alpha Tau, which is using...
Could you speak slowly? I don't hear well.
Okay, so the Israeli company called Alpha Tau is using new technology called the Alpha DART. DART stands for Diffusing Alpha Emitters Radiation Therapy. And they've had really exciting results treating squamous cell cancer in as little as 48 hours. It vanishes. It's in clinical trials now at Memorial Sloan Kettering, and including in another institution in Canada for pancreatic cancer. And I'm wondering if you have any thoughts on this.
Well, one of the articles I wrote with Kojima, the Japanese team, was using actinide 225 with the ligand to inject that, and it attaches to cancer cells, and the alpha radiation from the actinium 225 kills the cancer cells. So there is a move afoot to produce actinium 225 for use in cancer therapy. You attach that radioisotope to a ligand, and the alpha ray particle has a very short range. It only goes no more than 1 or 2 cells. So if you can attach it to a cancer cell, you pretty well kill it. So it's a very powerful treatment that's being used to cure cancer, including pancreatic cancer. I tried to get a clinical study going on low-dose radiation for pancreatic cancer, and I had a champion at our hospital in Mississauga to proceed, but the hospital administration stopped it. There was no funding for it, and the physicians make a good income using chemotherapy, so they're not interested in low dose option. It's unfortunate because people are not being treated
Well, the private
properly.
sector is funding alpha tau, so maybe that's the solution.
Dr. Cuttler, this is Dr. Donny Party from Yuma, Arizona. I'm an anesthesiologist. I'm very interesting presentation. I'm very thankful for your presentation. The question that I have is, do you have any exposure to using this modality in inflammatory bowel disease, which is a very...
Sorry, speak slowly. I don't hear that.
I'm sorry.
The last words.
Do you have any experience in the use of this modality for inflammatory bowel disease?
Yes, colitis. Patients were treated with that using radon.
Yeah.
And they had remission.
Speaker mentioned doing experiments in mice. You have to use guinea pigs because they don't make vitamin C. If you use mice, you have the same phenomenon running in two different ways. The vitamin C effect has been shown in rabbits and in human tissue culture. But if you want to do animal experiments on this, you have to use guinea pigs because they can't make vitamin C. You can study one phenomenon at a time.
Well, in Japan, they were treating people with radon. Radon is acceptable because it's a natural type, isotope people have in health spas. So there's no opposition apparently from the government to radon spas in the cities.
Okay, thank you. Thank you very much. And we'll see you later. And we're going to move on to our next presentation now. Thank you, Dr. Cuttler.
Thank you. It was a pleasure being with you. Bye-bye.
Yes.